Good morning, everyone. I'm Dr. Dipti, and I'm going to speak on does high heat environment is responsible for cataract and epidemiological investigation in blast furnace workers. I have no financial interest. The relationship between heat and cataract was first studied by Hister and Winzel and in as early as 1739 in glassblowers, which was also known as a glassblower's cataract. By 1929, heat cataract came to be recognized as an industrial disease, but surprisingly, not adequate studies has been done. India being an industrial giant, there are a large number of industries like the steel industry, the glass industry, the aluminum and the cocoa oven plants where thousands of workers are exposed to high heat on a daily basis. The current study was conducted among workers of blast furnace in one of the largest steel plants of India, where approximately 700 workers are posted and work in extremely high temperature, about 1200 to 1500 degrees Celsius. The aim of my study was to investigate whether occupational exposure to heat is responsible to cataract. It was an observational cross-sectional study. Timeline was from Jan 2021 to March 2022. We took we took two groups. One were cases were from workers of blast furnace. Controls were from non-heat exposed regions like marketing, personal and finance. Both groups were age matched and informed consent was taken. Age group 30 to 50 years were included. Persons with previous history of ocular trauma, surgery, diabetes mellitus, steroid use were excluded. A detailed questionnaire regarding lifestyle, occupational, medical and ocular histories were taken. A comprehensive ophthalmic examination including fundus, OCT and applanation was done. Cataract was defined as lens opacity greater than 5% of lens surface on retroillumination. We got 92 cases and 92 controls. In company's policies debars women from furnace areas, so all our cases were male, and to prevent gender bias, we took also controls were also males. The mean age of cataract in cases was 46 plus minus 5.2 years. Mean age of cataract in controls was 48.5 years, with standard deviation was 6.8 years. In controls, the lenticular opacity was 38.4%. In cases, the lens opacity was 54.34%. The odds ratio was 1.9, which means that almost twice the odds of getting cataract if one is posted in the furnace. Nuclear sclerosis was the predominant cataract, followed by PSC, true exfoliation, and also alarmingly there were 12 cases of mature cataract and 5 of them were not even aware of the cataract. When we analyze the duration of posting in the furnace with the number of persons having the cataract, after 10 years of exposure, there was steep increase in the persons having the cataract. The Pearson correlation coefficient was 0.9, which shows a positive correlation. These are some of my photographs of the cases. Coming to the pathology, the exact pathology of heat cataract is a highly debated issue. In Pick's lens, it is found that under the influence of heat, the alpha crystalline protein of the lens, it undergoes a loss of its native conformation, leading to partial unfolding, ultimately leading to cataract. So summarizing, the key points of my study was that compared to their non-heat exposed counterparts, blast furnace workers had greater prevalence of cataract, earlier age of onset and positive correlation with duration of exposure. Our study findings were similar to the Sweden industry, iron and steel industry, who had shown the risk to increase to 2.5 times. In Wales, their heat exposed workers had 63% of lenticular opacity compared to 48% in non-heat exposed workers. Similarly, Bangladesh rolling mill workers have 15% of lenticular opacity. Swedish study also had exfoliation cases. The main limitation of the study was that when we visited the plant, these workers are also exposed to infrared radiation, which can serve as a possible confounding factor. This study would have been stronger if we could have quantified the exposure dose so that dose-effect relationship could be established. So take-home message will be the ocular health and productivity of labor are highly correlated. In order to recognize thermal cataract as an occupational hazard, the first point is one should be aware, both management and workers, and guidelines should be formulated. Regular eye examination should not be just an option, it should be a mandatory for each and everyone who is posted in the furnace. And just like in plant, the safety shoes and safety helmet is compulsory, and without that one cannot enter the plants. Each and every furnace worker should be provided not just with regular safety goggles, but goggles with thermal shield. Then, and last and not the least, more studies should be made in India by rummaging the literature. Not a single study has been found in India. Thank you.
Thank you. Excellent. Dr. Rekha, have you heard the term nutritional cataract?
Sorry, sir?
Nutritional cataract.
Yes, sir, I've heard it.
What is the difference between this glass blower cataract and nutritional cataract? Because these laborers who are working in front of furnace
Yes, yes.
are of low socio
No,
middle class.
Sir, I would differ. This study it was irrespective of the socio-economic study. The first, actually, the idea of getting this study was one of my husband's friend. He's an executive, and he's just 35 years old, and he had that cataract. So that got me into thinking. It is not that the non-executives or the low socio-economic persons were getting the cataract. Even the high class executives were getting in 50s, in the early 45 years. We had one of our general manager who was 45 years old and he had the cataract. And when compared to his counterpart who was in the finance department, so this was the age matched.
I'm confused.
Yes. No, sir. Whenever there is a breakdown in the steel plant, even the GM has to also go and work for, in order to, even the high class engineer, he has to also get exposed to that. No. But still, then, sir, that is why one of my limitation was that I could not quantify the amount of exposure. But exposure is there. Yes, sir, I have told in my limitation, that was the limitation. I cannot quantify. But the exposure is even for the GM and even for the non-ex worker.
Why nuclear sclerosis is more in your study?
Sir, some studies in the student study.
That was actually the direct question for you.
Yes, in the literature it has been one of the theories is that the heat get concentrated in the posterior capsule, and for that it is just a theory. The exact pathogenesis still we don't know. So heat get concentrated in the posterior capsule. Even Wenzel, when he did the study, he had told the exact theory in 1739. In their why it is nuclear sclerosis? Then posterior. Sir, in the posterior capsule, then it gets concentrated in the nucleus. But exactly why in the nucleus, that we don't know. And moreover, it was not very significant type of cataract.
Why I am asking, we are working in northern part of India, and we had lot of cataract patient, and in my clinical practice, 70% of my patients are female patients. Yes, and yes. That too, their mean age is less than 50. That's why what I am saying, and I am concluding that these ladies are still the second class citizen of our society. They used to have skipped their breakfast. They used to have skipped their dinner. Yeah. They have micronutrient deficiency. That's why they are getting this kind of sclerotic cataract in early age compared to Western literature. This is my presumption. I may be wrong, yeah, but certainly nutrition has some definitive good role to prevent pre-senile cataract.
Yes. So nutritional cataract is definitely one of the cause.
Congratulations.